to win Georgia, but you've got the chance to flip 2 Senate seats. I said, well, I got to go. I got to come.
That was Barack Obama speaking in Georgia today. In Turkey, in the past 24 hours, rescuers have pulled 2 children out of the rubble caused by a massive earthquake in the western city of Izmir. The first was a 14-year-old girl rescued almost 60 hours after a building collapsed around her. The second, a 3-year-old, trapped for 65 hours. Here's one of her rescuers describing the moment.
Elif was lying on her back. We thought she was dead. I asked my team for a bag or a blanket, and after we cut away some iron, I wiped some white dust from the rubble off of her face. And I held my hand out, and as I held my hand out, suddenly she just grabbed my thumb. When she grabbed my thumb, in that moment, my friends, my whole team, we just froze. We started crying with joy. We were crying. We stayed close to the child. We didn't know what to do. We forgot everything, what we were meant to do, what we were meant to say.
An emergency worker speaking in Turkey there following a massive earthquake. And that toddler he was describing rescuing is thankfully doing well in hospital. Tougher coronavirus restrictions are coming into force across Europe in response to rising cases. Spain and France, for example, have today set records with more than 50,000 new cases each. A nationwide nighttime curfew will be imposed in Italy. Later this week, travel between regions there will be banned and secondary schools might move teaching online. The President of Portugal is considering whether to declare a state of emergency before a new lockdown tomorrow. And on the first day of fresh restrictions in Germany, the Chancellor Angela Merkel is warning that people will have to limit their contacts for the whole winter. The BBC's Damien McGuinness has more.
Germany's new restrictions start today and will carry on until the end of November. They're very different to the restrictions we saw at the beginning of the year. It's being called a lockdown light. What that means is that all sorts of socialising is going to be restricted to a bare minimum. So bars, cafes, restaurants, leisure activities, cultural activities will all have to close. Those businesses that are closing will get up to 75% of their income covered by the state. What will keep going, or what will stay open, are schools, most workplaces. The idea is to keep the economy going, to keep people working while reducing social life. This is because daily infection rates have really shot up in Germany over the past few weeks. The worry is that if this carries on, that Germany's health service would be overwhelmed. But it has to be remembered that Germany is still faring better than comparable European countries. The overall death toll here is just over 10,000. That is much lower than, say, France or the UK or Spain or Italy. Nevertheless, Germany is worried that if these infection rates keep rising, Germany could find itself in a very similar position to other countries in Europe. That's why Angela Merkel has said it's going to be a tough November and possibly even a tough winter.
Meanwhile, England, with the highest number of coronavirus deaths in the whole of Europe, more than 4 times as many as Germany, is due to begin a second lockdown on Thursday, lasting 4 weeks. A vote will take place in the British Parliament tomorrow, but it's almost certainly set to pass. Yet there is much disquiet among the Prime Minister Boris Johnson's own party ranks about the lockdown, and not just about the effect on the economy or mental health. Here's the BBC's Rob Watson.
It's hard not to see this as a new low in his premiership because he was under attack from all sides. And in many ways, it's not surprising because if you think about what he was trying to do, he was trying to sell a policy, that is the national lockdown, which only just recently he had described as absurd and a disaster. And so he found trouble on both sides of the argument. So from those who think that he's just been dithering and has made the same mistake as he did in March of acting too slow, they say that his delay has caused lives. And of course, from the other side of the argument, those who are against the lockdown, he was told that the cure was absolutely worse than the disease and that this could not go on.
Rob Watson reporting from the UK. To Australia, and Queensland's border with regional New South Wales is now open. Greater Sydney, though, remains still off limits. As expected, there have been big queues at border checkpoints. Kathy Border reports from Queensland.
The change came into force early today, and already this morning some motorists have been turned away at the Coolangatta checkpoint. While regional New South Wales residents can cross the border with a G pass or still valid X pass, Victorians and residents of Greater Sydney are still banned from entering the Sunshine State. People can travel through Sydney City, but only for essential stops or driver fatigue. They can't stay overnight and must wear a mask. This is the 17th change to the border crossing arrangement since March. The restrictions will be reviewed at the end of the month.
The ABC's Kathy Border reporting there. The UN has highlighted what it calls a worrying trend in the nature of the threat journalists face around the world. A report shows that while fewer journalists have been killed in war zones over the past 2 years, the number of those killed for exposing corruption or rights violations has increased. Mexico is the most dangerous country. Dozens of journalists there have been murdered while investigating drug cartels. Baby Shark, the infuriatingly catchy children's rhyme recorded by South Korean company Pinkfong, has become the most watched video ever on YouTube. The song has now been played more than 7 billion times, overtaking the previous record holder Despacito, the Latin pop smash by singer Luis Fonsi. Played back to back, that would mean Baby Shark has been streamed continuously for 30,187 years. And finally, a train driver in the Netherlands has escaped serious injury or even death thanks to a fortuitously placed art installation. A metro train near the city of Rotterdam crashed through a barrier at the end of the tracks, but rather than plummeting 10 metres into the water below, the train was left suspended dramatically in the air. It ended up being delicately balanced on the large sculpture of a whale's tail at the De Akkers metro station. The sculpture, titled Whale Tales, was installed in 2002. And Marnie, I would strongly recommend taking a look at the extraordinary images of the crash. It looks like something out of an action movie.
Wow. And I advise you to keep watching Baby Shark, because I don't think you probably even have listened to it. Oh no.
That's World Watch for today. I'm Max Toll, Marnie.
Kia ora, Max. And koina te puro te paututanga mō tēnei rā tua toru o whiringa ārangi Tuesday, November the 3rd. And shortly, RNZ will bring you the latest COVID-19 update with the Minister for COVID-19 Response, Chris Hipkins, and Dr. Ashley Bloomfield. Stay with us for that. Big mahi to Patrick Hahn, Denise Garland, and our operator Jordan Edwards for their amazing mahi behind the scenes. Hey Apple.
RNZ News at 1 o'clock. Good afternoon, ko Kainwyn Curtis tēnei. We'll cross to the news conference at the Beehive Theatrette as soon as it begins, but first the news. Christchurch's mayor wants to remind people to use the COVID Tracer app after a worker at a man isolation hotel tested positive for the coronavirus. It's the first new community case in the South Island since late July. Leanne Dalzell says the case is concerning and people need to remember to scan the app. Meanwhile, queues are forming at a COVID testing centre near Christchurch Airport, with dozens of cars lining up. The testing station is near the Sudima Hotel, where more than 200 Russian and Ukrainian fishers are in managed isolation. 31 are confirmed to have the virus. The country's managed isolation hotels are almost completely booked until Christmas, locking out some people wanting to visit their families. It's now mandatory for people to book the 2 weeks in isolation before getting on a flight. But the service says there are very few rooms free in the next month. A New Zealander living in Perth, Kimberly Everett, was trying to get home for Christmas, but says she hasn't been able to secure a spot at all until December the 15th and is devastated. Briscoe Group has reported strong sales over the past 3 months, which it attributes to continued pent-up demand after the COVID lockdown. Its sales for the year to date are up 2.35% on last year. In September, Briscoe's reported a $28 million half-year profit and that it would repay the COVID wage subsidy. The company says paying back the $11.5 million as well as not receiving a payout from Kathmandu will take a toll on its total yearly profits. The father of an 11-year-old girl who died in a shuttle bus crash on Mount Ruapehu 2 years ago tried to save her life with mouth-to-mouth.
Kia ora, good afternoon, everybody. I'll hand over to the Director General shortly to give you the daily update on COVID-19, but before I do that, I wanted to make a few introductory remarks. As you'll be aware, the Prime Minister announced yesterday that I'll take on the new role as Minister for COVID-19 response. That'll give me ministerial responsibility for all aspects of our ongoing response, including our managed isolation facilities, our border defences, as well as our health response, including our testing and contact tracing, and the management of any resurgence of the virus. I'm under no illusions about the scale and the importance of that role. Managing COVID-19 is crucial for the health and the well-being of New Zealand and New Zealanders. You've heard me say this many times before, COVID-19 is going to be with us for some time. Since the start of the global pandemic, the total number of cases worldwide is now more than 46 million, with almost 1.2 million deaths worldwide. Yesterday alone, the World Health Organization reported 440,000 new cases and over 5,500 deaths as a result of COVID-19. Sadly, the rate of new infections continues to climb around the world, so it's vitally important that our systems here in New Zealand are as robust as they can be. That's why we've put such an effort and resource into keeping the virus contained at the border through our managed isolation and quarantine facilities. We will continue to treat everybody arriving in New Zealand as if they have COVID-19 until they have demonstrated that they don't. We have rigorous infection prevention and control measures in place for anybody who has contact with recent returnees and a program of regular testing, and that system is working. This latest case of a worker at the Sedima Airport managed isolation facility in Christchurch was tested last Thursday as part of regular testing, and they returned a negative result. They subsequently developed symptoms, got tested again, and they returned a positive test result yesterday. That means we've got a very small window of time when they were potentially infectious. Our contact tracers are already on the case, ensuring that we can contain this case and limit any spread from it. And I want to thank that worker for seeking out the test, even though they had been tested just days earlier. It's a reminder to us all, if we start to develop symptoms, get a test as soon as possible. It's also a reminder to everybody to keep good records of their movements and their contacts. An alert has been sent to people who signed in with the app at the Beckenham countdown on Sunday. Please keep scanning with the app. It only takes a few seconds, but it does give our contact tracing team a real head start when they need it in cases like this. COVID-19 is a tricky virus. No matter how good our systems are, we will see cases emerge from time to time. The key is to identify them early, to contain them, and we have done that several times in recent months. Given this latest case at the Sedima, we're also delaying the release from managed isolation of the Russian fisheries crew, and the Director General will comment more on that in a moment. Before I finish, two further things. I want to note that from today it's compulsory to hold a managed isolation and quarantine voucher in order to board a flight to New Zealand. This will help us more easily manage the numbers coming into the country to match the capacity in our managed isolation facilities. Demand for space in those facilities is currently very high, and we're anticipating higher than usual demand as we continue the run up to Christmas. This may mean that some people need to rearrange their travel to fit with the times that we have available in managed isolation. I know that will be disappointing for some people and for their families, and there is a provision for people to apply for dispensation to travel in an emergency, but I do want to reiterate that the bar for that is very, very high. In the end, though, we have a responsibility to ensure that anyone entering New Zealand can do so safely, both in their interests and in the interests of New Zealanders. Our managed isolation system is serving us well, keeping the virus at the border. And from Friday, when I become the Minister for COVID-19 officially, I'll continue to do everything in my power to ensure that it continues to do just that. I want to end on some good news today. Today I can officially report that the August Auckland outbreak cluster is now closed. The cluster involved 179 cases, 2,563 close contacts, and 261,130 tests. Because of the phenomenal efforts of everyone, not least the health sector staff, Auckland is now back to enjoying the freedoms that we all enjoy at Alert Level 1. But we are not at Alert Level none. In Auckland and across New Zealand, we need to keep using the COVID Tracer app. We need to continue to use protective measures like washing our hands, staying home if we're unwell, and getting a test if we have symptoms. It's important that we stay vigilant, that we protect ourselves, our whānau, and our communities. I'll now hand over to the Director General.
Thank you, Minister. Kia ora koutou katoa. So today there are 5 new cases of COVID-19 to report. 4 of these are at managed isolation facilities. 1 is in the community, and this is the case related to a managed isolation that we first reported on last night and is formally included in today's total. I will provide more detail on that case shortly. Of the other 4 cases we're reporting today, all are in quarantine at our Auckland quarantine facility. 1 case arrived on the 19th of October from Kabul via Dubai and tested positive at around day 12. Another case, the second one on the 21st of October from London via Doha and Brisbane and has tested positive at around day 12. The third case arrived on the 29th of October from the USA via Sydney and has tested positive around day 3. And finally, our 4th case arrived on the 29th of October from the USA via Doha and Brisbane and has tested positive at around day 3. I should note that, as you will have heard, the first 2 of those cases that tested positive around day 12, we now have a protocol where we look at each of these cases appearing in managed isolation to look at anything that could indicate that these are older cases. We're obviously very interested in any cases first being detected at day 12 to rule out any possibility of cross-contamination in the facility, and we will be routinely investigating and reporting on what we find with each of the cases. There are indications like a high CT value from their original test, and we will also be doing serology routinely to help us build a picture and rule out any cross-contamination inside the facility. 11 cases are now considered recovered, and that means our total number of active cases is 75. Our total number of confirmed cases that we report to the World Health Organization is 1,612, and yesterday our laboratories completed 2,455 tests for COVID-19, reflecting the tests that were actually taken on Sunday but processed mostly yesterday on Monday. Further information about the case that we announced last night related to managed isolation and subsequently detected in the community. So this person is a member of the health team at the Sedema Christchurch Airport Managed Isolation Facility, where the international mariners are in managed isolation, and for those who have a confirmed infection in the quarantine wing of that hotel. The individual was tested as part of routine testing for staff in the facility and, as the Minister has said, returned a negative test on Thursday the 29th of October. On Saturday, the person developed early symptoms, and did seek a further test on Sunday with a positive result received yesterday. The person is now in isolation. There is 1 household contact who is a student at Cashmere High School. That person has been tested once and returned a negative test already. As a close contact, they will remain in isolation for the full 14-day period and be tested again at around day 5 and day 12, which is part of our standard close contact procedure now. So today, parents, caregivers and staff at Cashmere High have received a letter around the contact. As advised in the letter, members of the school community do not need to be tested unless they have any symptoms of COVID-19. As per routine guidance, they are also not required to self-isolate. The community and public health team in Christchurch will be in touch with the school if there is any change to that situation. Otherwise, it is business as usual at the school today. Have been asked why this person and their household contact are self-isolating at home following assessment of their situation by the local medical officers of health. So the public health team is checking in on the person and their household contact daily. The individual, who's the case, remains well with very mild symptoms, and that person is of course able to call health staff at any time. Other staff at the isolation facility who may have worked on the relevant shifts are also in the process of being contacted and tested as appropriate, if they had or not already been tested in the last day or two through the routine testing that happens there. Likewise, public health staff in Christchurch are continuing to work with the team at Beckenham Countdown, where the person visited. As you would have seen already reported, the supermarket has undertaken a deep cleaning, and video footage is continuing to be reviewed just to assess if there is any potential that the case, when they were there and potentially infectious, had any interaction with either staff or other customers. Through our COVID Tracer app, we have sent out a push notification to people who had logged on and been in the supermarket, or logged in and been in the supermarket at a similar time to when the person visited. An important reminder for us all to keep using the app. There were less than 20 people who had scanned in, and I think we can and should be doing better than that. So again, an opportunity to encourage people. You never know when or where that information will be useful. Please do continue to use the app. Anyone who is concerned about the update today can, of course, contact Healthline for advice and, if necessary, particularly if they have symptoms, getting a test. There is plenty of capacity for testing in Christchurch. They have 2 community-based assessment centres and good support from local GPs. Demand for testing is already increased. That has been monitored, and additional testing capacity will, of course, be stood up if there is any need. The positive test for the staff member also means that the first of the international mariners who are due to complete their managed isolation this morning have had their stay extended for at least 24 hours as an additional precautionary measure, and while we get a full picture of the situation. Further genome sequencing of another 8 international mariners who have tested positive, as amongst those who are in that hotel, has shown there are 3 different lineages of the COVID-19 virus. And when we combine the results from the previous genome sequencing of 11, the first 11 infections there, we can see that none of the lineages has been seen in cases in New Zealand prior to the arrival of this group, and all are consistent with overseas infection. There was one similar genome sequence found in an individual who also travelled to New Zealand from Russia, and who arrived here on the 24th of September. Genome sequencing on the staff member working at the Christchurch Managed Isolation Facility and who was tested positive yesterday is expected later today. So in closing comments about this case, it's a reminder that our ongoing low number of cases in New Zealand, compared with what is happening globally, where we can see significant increases in infection in many countries. I understand that there is intense public interest in each individual case here, and it's just important to bear in mind, as I've said before, the virus is the problem. People are not the problem. They are the solution, and we have seen that here once again with this very dedicated worker who, despite having had a negative test a couple of days before, sought another test once they became symptomatic. Finally, on the New Zealand COVID Tracer, we now have 2,337,200 registered users. We've released a minor update to the app to make it easier for app users to find the nearest COVID-19 testing centre when needed. Simply open the app dashboard and tap the View Resources button that is part of the More Information tile, and that will take you to an up-to-date list of testing centres. The app will automatically update over the next day or two for most users, and if you want to manually update, the instructions are on the Ministry of Health website. Thank you, Minister.
Thank you. Happy to open up for questions. Yeah.
Do you have any more specific details about the role of the health worker, and do you have any leads on how they got COVID?
They're a member of the health team there. I'm trying to strike a balance here between providing as much information as possible but also respecting the privacy of the individual. We're working very hard to find out where the source of the infection might be. Obviously, we're very interested to see if there was a breach of the infection prevention control protocol, because we also want to make sure, and that's why we're testing other people who are on the shift with that person, and over and above the regular testing that's already happening, to see if there is any other cases. It's possible we will find other cases, and if so, we will report that immediately.
When did the ministry learn about the countdown visit?
We learnt about the countdown visit late yesterday afternoon. Yes.
The original message was that the staff had begun self-isolating from Saturday, so what changed there?
Sorry, that the staff member...
The message from the ministry was that the staff had begun self-isolating from Saturday.
Yes, so I think our early information was, what we try to do now is release information as soon as we have it available. Our early information was that the person had self-isolated, in other words, not gone to work, but then the symptoms had started to develop further on Sunday, so that's when they sought a test. But in the meantime, there had been this outing that had included the visit to the Countdown supermarket. And as I say, the critical thing here is time. So we want to get the notification out around any places where there may have been some exposure to the individual while they're infectious, so that people can isolate if needs be and be tested.
Over what time period had those 20 people signed into Countdown? It's a very low number.
So that was during the approximate hour period that when the individual who's now the case, had made the visit there. It is a low number. We also had a low number at the pub that was involved in the case in Auckland a couple of weeks ago. And again, this is just an important reminder to people. This is an incredibly important part of our overall response to scan in and keep that record. So please keep doing so.
Should businesses be encouraging people to sign in?
Yes, and in fact that's the message we've been giving. There are two things businesses can do: make the QR code very visible and make it easy for people to scan it. And also, yes, I would encourage businesses to actively encourage people to scan in.
Yeah. Disappointed that the woman went to Countdown even though she was...
Oh, look, I don't have a particular view on that. I'm not close enough to know exactly what the movements were and what her movements were and what the symptoms were at that time.
But your message to the public is if you have symptoms, don't go.
Well, the broad message, of course, is if you have symptoms, don't go to work and seek a test.
Why is that worker self-isolating at home and not in a facility?
The requirement to isolate in a facility is not a strict requirement, and it depends on the judgment of the local medical officer of health. I think there is a high level of confidence that I share with the medical officer of health that the person will be self-isolating rigorously, and secondly, it also allows we also take into account in each case the personal and family circumstances of the individual.
So it's nothing to do with a capacity issue at the facility?
No.
How many extra testing stations are being set up in Christchurch?
Well, we have the existing testing stations. There's obviously the two community-based assessment centres, and the DHB will be standing up some pop-up testing as well, and once we know the locations and hours of those, from tomorrow we will make that public.
And is the Ministry satisfied with how procedures have gone here? Is anything different with the way that the Sudima facility is managed, or is it also as per?
Look, the Sudima is unique in the Christchurch setting in that it has both the managed isolation and quarantine parts of the facility. The same protocols, infection prevention control procedures apply in every facility. What I would say is that, again, this is the system working, and I was just reading some commentary from Professor Nick Wilson that labelled this as yet another border failure. I don't agree with him. What we have to remember here is that the border does not finish at the airport or the port now. It extends effectively into our managed isolation facilities. And so people do not enter the New Zealand community until they have completed that period of time in the managed isolation facility. I think this is another example of, if you think about the thousands of people who are both in facilities and transiting through there, and the thousands of staff working there, this is another example of the system working well to protect our border.
If I could note too that the infection prevention and control in our managed isolation facilities has been audited twice now. Each time, potential improvements have been identified and they have been actioned. There is no such thing as a 100% foolproof system, which is something that you've heard us say many, many times. We're always looking for areas where we can improve. The feedback that I have had, and I have seen it in my own visits, the staff go to great lengths to keep themselves and those around them safe. But COVID-19 is ultimately a virus, and we all have to be prepared for the fact that from time to time viruses spread despite the very best protective measures put in place. And so we need to be able to respond quickly. And that is why things like the COVID Tracer app are very, very important. It is why people taking personal responsibility, as this person did, to keep themselves isolated when they need to seek testing when they need to. These are all very important things.
Dr. Nick Wilson, though, he said that those prevention measures exist so that workers can go to work and not get infected, and these several workers have become infected. There was the lift worker, the port worker, and then this worker. Surely, a successful control would mean that those workers are...
I'll look at the Director General, of course, I know will want to comment on this as well, but the comment I would make is in every one of those cases we've learned something new. Who would have thought that a lift button, something as simple as a lift button, could be a source of transmission? So further protective measures were put in place following that. All of the time, whenever something like this happens, we look and we say, is there something we can do to build in an extra layer of protection? And then we take action on that. We've done 2 separate audits of infection prevention and control, each one of them identifying potential improvements, and each one of those, we've had a series of actions following on from that, and we keep doing that. This is a system that we'll have to keep learning. Every time something happens, we look at it and say, could we do more to prevent that happening again in the future?
Just a follow-up comment there, if I may, Minister. Look, again, if we think about the number of people who have been through, over 60,000, for 14 days each of them in there, and the number of interactions there will be between those returning Kiwis and the fantastic staff who are working across over 30 facilities, nothing will be 100% foolproof. And as the Minister said, we're constantly reviewing, constantly improving, and there is no one who is keener to be protected from the virus than the people who are working in the facilities. Yes, we are planning to.
Have you released the Simpsons to Brian Rush?
Yes, well, we will release that as well. Obviously, we needed a chance to digest that and to consider it, and in this post-election period, that's exactly what we are doing, and then we will certainly be releasing that.
Another issue raised by Nick Wilson is that the crews at Sudima are double bunking. Is that appropriate?
So that was an arrangement that was agreed, and this was the first time that had been done. It is something that will be reviewed, certainly before we receive the next tranche of crew members who come in. I should say that the cooperation from the crew in the facility, all the reports I have, they've been very cooperative, very understanding of what is required of them. And of course, whenever a case is identified, then the crew members who have been in the same room are under close observation and treated as close contacts, and several of the follow-up cases have come from there. I should also point out that we do have families together as units already, so it's not uncommon for there to be more than one person in a room in a managed isolation facility.
The next tranche was due to arrive on Monday in Christchurch. Is that still happening?
My understanding is that they have agreed to delay the further flight until we give them the okay to do that, and we have not done that yet.
So what sort of time frame are you talking there?
Look, at this point, we've got a little bit to do in the next 24 to 48 hours before decisions are made about when space may be freed up through the release of the people who are currently occupying those spaces. So it's a bit, I can't give a specific time frame at this point.
How big is that tranche that's due to come in?
I don't have the number on the number expected. It'd be similar probably in size to the previous group that came in. It'll be another charter flight, basically.
Did the worker use the COVID tracer app before, during and after visiting the supermarket?
I couldn't say that. However, it's usually just once that's required on the way in, but I don't have that information.
Did that on the Heather Simpson and Sir Brian report, don't you need to be more transparent with the public and get that report out there as soon as possible?
Yes, look, we will release it. The Director General himself has not had a chance to look at that yet. It arrived not long before the election, and obviously we need a chance to consider that. I need a chance to discuss it with my colleagues. I need a chance to discuss it with the people whose work it covers, and we will certainly do that. We're not going to waste time in doing that, and we will then release that.
A couple of weeks ago, there was this trio of sort of cases related to the port, and there was a question around whether one of them had been infected by being within a metre of the other for just a 3-minute period. Is there any more sort of light been shined on that in the intervening period about how that person might have been infected and whether it was from that very short duration of exposure?
From memory, this was persons A, B, and C, and in fact, you may recall that additional information about the exposure between those 3 people was gained as the case investigation went along. But I haven't got the most recent up-to-date on that, but the Director General may have.
Thanks, Minister. So I've asked the team in the next 48 hours or so to just report back on the detailed forensic sort of examination of the interactions in particular that the workers who went on board the ship, the Savannah Seville, had with crew, because we're very keen to find out exactly which interaction or which circumstance may have led to the infection. Originally, so part of that could be to do with the fact that it may be that both of the workers who'd been on the ship became infected at the same point in time, and that one or other of them infected the other person in the company, and it wasn't just through that very brief interaction on the Friday morning that the worker, the original case, became unwell and then sought a test.
Is there any update on the potential timeline for the rollout of Bluetooth contact tracing to the COVID Tracer app?
No, we have, as you'll be familiar, my colleague Chris Farfoy has been working on that. There are some trials that he's been working his way through. That's something that I'll be picking up after Friday when all of this gets formalised. I haven't had a chance to look in detail at that yet. But I think the couple of messages here, though. One is there's no such thing as a silver bullet. A COVID card or a Bluetooth technology solution may well be part of the toolbox, but there's unlikely to be one single thing that's going to end up being the absolute, the absolute answer here. The key message for everybody at home is if you suddenly found that you had to do your contact tracing for the last fortnight, could you do it? If you can't, what are you doing to change that? Are you going to use the QR code more frequently? That would certainly be my recommendation at this point. Are you keeping, we've got a booklet for some of our senior citizens who prefer not to use the QR code. Everybody should be keeping some kind of record so that if they need to do contact tracing, they can.
I'm concerned about how much further this might have spread, especially given testing centres aren't as busy as they once were.
Look, testing rates, would like to see our testing numbers go up. We're still looking reasonably healthy. I mean, we've done over 34,000 tests in the last 7 days. So that's a reasonably healthy testing range for where we're at in terms of our risk profile. Dropped down a little bit in the last couple of days. We're from a high of about 7,500 that we were looking at. It's dropped down a little bit. So, we'd be looking to try and get those numbers up a little bit. But, we've got to look overall at the week. You do see, peaks and troughs during the week. I think our testing numbers are still looking reasonably healthy, though.
Are you finding out any more about the decision about when to release the fishermen that are there at the moment? What will decide that, whether they stay or whether they go? And it's 24 hours.
Well, one of the things that I'll be looking at is what more do we know about this most recent case, where the source of infection might have been. Does that bring anything else up that might cause us pause for thought around the release of others? Could there have been any other cross-contamination or cross-infection there, if you like? So those are the sorts of questions that we'll be getting into once we've got a bit more information about this current case.
There are concerns that given the size of Cashmere School, the horse may have already bolted. Are those concerns valid?
I can comment. So just to recall, there's the one household contact who is a student at Cashmere. That person was tested yesterday and is already tested negative and is now in isolation. So again, it's a message of reassurance to that community. The right steps have been taken, and it's just a matter of being aware. There's no sense that any horse has bolted here. Remember, we've got the one case at the moment, and the household and work close contacts are all being tested.
Okay, we'll come back over there.
Should the school limitations on managed isolation spaces, is that due to a shortage of health staff? And if so, how many more health staff are needed?
Look, that's something that Megan Woods has been handling up until this point, and her and I haven't had a chance to have a proper handover of that yet. We'll certainly do that in the next sort of 48 hours or so. We do manage carefully. We don't want to have a whole lot of beds empty if we don't need them to be empty, but we also do need to allow a little bit of a buffer there too. So there's a variety of things that we need to keep in mind. There are a variety of things that constrain our ability to continually expand the system. Suitable accommodation is one of them, so not every hotel makes a suitable managed isolation facility. Workforce is one of them, and bearing in mind that workforce is not just about the isolation, but it's also about the escalation if you need to escalate. So if you end up with, as we have at the Sudima, a series of positive cases, you've got to have the workforce that can escalate the response where that's required as well. So those are all things that I know the team have been very carefully managing. This is not an unlimited workforce. So we don't have an abundance of trained and registered nurses, for example, across the country sitting around with not much to do. Generally, nurses are pretty well deployed around the country. So we do have to work within those workforce constraints, but I'll be getting into that a little bit more.
Is there any proactive asymptomatic testing of those countdown workers happening currently?
I'll ask the director.
Not at this point in time, no. So they may well choose to be tested, as may those who were in the supermarket at the time. There will be active testing of anyone who's identified through the CCTV footage as having had interaction with the case as a precautionary measure.
All right, last couple of questions.
Dr. Bloomfield, how do you feel about being a finalist for TV Personality of the Year at the TV Awards?
Oh, well, I'm very humbled, and let's just see what rolls with that one.
Have you ever wanted to be a TV star?
It's not something I dreamt about in my childhood, or my adulthood for that matter.
All right, we'll go to Derek and then Anna, and we'll wrap it up there.
Would you then classify the risk of spread at the countdown to be very low, and did the health worker scan in using the tracer at the countdown?
So I'm not sure about the scanning, and I responded to that earlier on. I think yes, we would categorise the risk. We have seen, recalling those cases we had a couple of weeks ago, where actually someone was at a pub with a group for some time, and we didn't get any further infections there. Remembering that was in that case in the sort of asymptomatic period. So likewise, the gym setting there, and we have seen this previously. You'll recall that when we had a case amongst a health worker at the Jet Park a number of weeks ago, that person had also been to a gym. Again, we saw no onward transmission. So our experience is that this is low risk with that sort of those transient interactions with people. Not that I'm aware of, but if we do find any other places, we'll of course make that public immediately.
Will school be taking any additional precautions?
The main precaution is the advice given to parents, which is just keep an eye out for symptoms and actually do everything that every New Zealander should be doing at the moment. Not going to school or work if unwell, use the app and seek a test if you have symptoms.
Have we become too complacent on mask use and on signing in?
Go on, Minister.
Well, yes. I would say yes, particularly on the signing in and contact tracing. We have seen quite a significant drop-off in the number of people who are using the QR code system to record their movements. It is a very effective way for us to be able to notify people if there is any heightened risk for them, and that only really works if people are using it regularly and scanning in. And I think, in my travels out and about, I've certainly scanned codes that a lot of people have been walking past. And I think if everybody just lifts their game there a little bit, it will be a really helpful tool for us. That's what it's designed to be. So yes, I would like people to be doing that more. I think that, coming back to it, and we've talked a lot about this over the last 10 months or so, but the basic preventative measures that everybody can do still remain the most important, which is, good hand hygiene, coughing into your elbow, wearing a mask when you're on public transport, staying home if you're sick, getting a test if you show any COVID-19 symptoms at all of these things are the basic things that every New Zealander can do to keep us all safe.
Do you want to see people wearing a mask on public transport?
Yes, I'd certainly recommend it.
Okay. Can I just make one comment further on the QR codes? Because the QR code approach that we took got a bit of a bad rap in early days. Can I just say that a number of countries are adopting this approach, including Singapore, which you will recall went down a Bluetooth track early on. Different approaches in different Australian states, but New South Wales is effectively following the same approach we're taking, the NHS in the UK, South Korea. So there are other jurisdictions that are looking and seeing that this is an approach and a technology that actually has real benefits. It's different from Bluetooth technology, so saying we are still looking at adding Bluetooth functionality to the app here, and hoping to have more information about that in the next few weeks.
Having said my last comment was my last one. Actually, I've got one more, which is that businesses are enjoying an enormous amount of freedom to trade at Alert Level 1. And those businesses can all play a role in making sure New Zealand stays at Alert Level 1 and they continue to be able to operate in that way, and making sure they're prominently displaying the QR code and encouraging their patrons to be using it to scan in and to keep good records is one of those things that they can do to ensure that their business can continue to operate by ensuring that the country remains at alert level 1.
Mandate that businesses have to say to customers, here's our QR code.
So at the moment, businesses do have to display a QR code. Again, I would encourage them to display that prominently, so don't put it in the corner, put it right at the front door, put multiple copies of it up so that if you've got multiple people entering at one time, they can all scan in easily. Do those sorts of things. If you're a bouncer on the door of a bar, tell people to scan as they're coming in. Do those basic preventative measures, and then we're far less likely to be dealing with a more widespread outbreak in the future, which might change the level of freedom that we're all enjoying. Thank you, everybody. Look, we don't intend to make it mandatory at the moment, but as I've said all along, we keep everything under review all of the time. Thanks.